President Biden delivered a message to governors Tuesday telling them to help fight the coronavirus surge or, quote, please get out of the way. Mr. Biden gave an update on vaccination efforts, stressing this is a pandemic of the unvaccinated. The average pace of first dose shots is climbing. It's now up at least 25%. But there are still more than 90 million eligible Americans who have not lined up. Coronavirus cases are rising nationwide, including in New York City, where officials announced a new policy Tuesday to boost vaccinations. Nikki Battiste has the details.
Even as doctors and nurses plead with Americans to get vaccinated as a way out of the pandemic, there are still holdouts while hospital beds fill up. So to get needles into arms, New York City is turning away from lotteries and gift cards and trying something new.
It's time for people to see vaccination as literally necessary to living a good and full and healthy life.
Beginning next month, anyone going inside a New York City restaurant, gym, movie theater, or performance space must prove they've been vaccinated with at least one dose or be turned away. Outdoor dining will still be allowed. Children under 12 who aren't yet eligible for the vaccine are not affected by the mandate. New York City's mandate is similar to what's already in place in France, where two things have happened: loud protests and millions who have now scheduled vaccine appointments.
So I think it's one of those things that's understandable how some people may push back on it, but I believe it's a prudent and necessary thing to do.
Do you anticipate that other cities across the country may follow New York City?
I do. I actually do.
In New York City, 66% of eligible adults are fully vaccinated, but new COVID cases have risen more than 400% just in the past month.
Are things so bad that a mandate like this is necessary?
We need to get ahead of this, and that means being more aggressive about getting people vaccinated.
Even ahead of the mayor's mandate, the owner of Tavern on the Green had already required staff and indoor diners to show proof of vaccination.
You want herd immunity. You want all of us to be a part of a community helping each other. And in order to do that, we all just have to get vaccinated.
In order to go inside these New York City restaurants, people will have to show proof of at least one COVID vaccine dose using either a physical card or a city or state app. The mandate takes effect September 13th, the same day schools here reopen. Elaine?
Nikki Battiste, thank you. Dr. Ali Raja joins me now. He's a professor at Harvard Medical School. Dr. Raja, welcome. President Biden stressed that this is a pandemic of the unvaccinated. He urged governors, especially those with rules against vaccine or mask mandates, to help fight the latest surge, but said if they won't, to, quote, please get out of the way. Doctor, what are your thoughts on that?
Elaine, I couldn't agree more. The vast majority of deaths and hospitalizations we're seeing around the country are in people who are unvaccinated. I've seen a few breakthrough infections in my ER, but they've all done well and gone home because they're breakthrough infections in people who have gone vaccinated. When I call them back a couple of days later, they're all doing well. They haven't ended up back in the hospital. The same can't be said of people who haven't been vaccinated.
So New York City will soon begin requiring proof of vaccination for indoor dining, fitness and entertainment settings. Mayor Bill de Blasio said, quote, it's time for people to see vaccination as literally necessary to living a good and full and healthy life. Doctor, do you think this is an effective strategy?
I do, Elaine. It's a big step. I realize that. But as an emergency physician who sees people in the ER and has been through a couple of surges of this already, it's one that I'm fully supportive of. It's a great way to slow down the spread. And quite honestly, people want to feel safe when they go out. And for those who have chosen to become vaccinated, they should feel safe knowing that they're surrounded by others who have chosen that as well.
So the director of the National Institutes of Health says reaching herd immunity may not be possible given the Delta variant, but he says we could get to a point where COVID-19, quote, becomes a nuisance instead of a threat to your life. You know, it's hard to imagine that in this particular moment. Doctor, what does he mean, and do you agree?
I worry a little bit about that, Elaine. I worry, but I'm still hopeful. As you said, the pace of first dose vaccinations has gone up week over week. And if we still get people vaccinated and potentially use mask mandates in areas where we start seeing surges, I'm still really hopeful that we can slow down the spread and reach herd immunity. So I'm not writing off herd immunity just yet.
Dr. Fauci says that we could see between 100 and 200,000 cases daily before the situation in the U.S. begins to turn around. And the former U.S. Surgeon General also says this surge, quote, has every potential to be the worst surge we've faced so far. So, Doctor, how bad could it really get for states that are farther along in their vaccination journey? And what does it mean for the states that are not?
Elaine, that's exactly the dichotomy. I think that's such a great question. I practice here in Massachusetts, where we've got a really high vaccination rate in New England compared to many other parts of the country. We're seeing some cases, but we aren't seeing the surges that other parts of the country are seeing. I'm from Texas originally, and a lot of my friends still practice medicine in Texas, and they're seeing huge surges. Their hospitals are just as full as they were during the first and second surges earlier this year and last year. This could be just as bad, if not worse, and it really worries me because, quite honestly, all of our healthcare personnel are just worn out right now.
You know, I want to ask specifically about children. The American Academy of Pediatrics says about 72,000 cases were reported among children and teens last week. Doctor, that seems like a fairly large number, especially since the school year has not even started yet. How concerned are you about kids returning to classrooms?
I'm definitely concerned, and I think there's a couple of populations. We're starting to see more breakthrough infections of the Delta variant in vaccinated kids over 12, and we weren't seeing that with the earlier variants. But I have to tell you, honestly, I'm the parent of two young kids, a 7-year-old and a 9-year-old, and I'm really worried about them and their compatriots. They're not vaccinated. They're going to be wearing masks, and I just want them to get back to normal as soon as it's safe. So I've got to tell you, as soon as we see data out for the vaccines for kids under 12, and if that data looks as safe as it does for older kids, we're going to get them vaccinated. We need to get them back to school, back to normal as soon as possible.
Yeah, that return to the classroom really is top of mind for parents across the country. Dr. Ali Raja, doctor, thank you very much for sharing your expertise with us.
Thanks, Elaine.